I've always been a very active and individual. I've always been a jogger because I played sports in high school and college. And so a quality of life I'd grown to accept was a very active one, whether it's the jogging or the swimming or the hiking in the mountains, whatever. We always did a lot of activity that required a good bit of physical activity. About 10 years ago, I was very active running. I ran a marathon. I'd run some half marathons and the like. But starting about 5 or 6 years ago, I noticed an increasing amount of pain and pressure in my lower back and my legs. So much so that about 2.5 years ago, I had to stop jogging because the pain was not only while I was exerting physical activity, but it was also after I finished. So in that respect, I really felt a void, and we had about the same time a grandbaby enter the family, and it was like any grandparent, it was my desire to pick her up and hold her as much as I could, and that was very uncomfortable. So within another year, it was so bad that I had begun walking instead of running because the pain was too bothersome. About 1.5 years ago, I also was experiencing the pain had increased. I could not even walk more than about 75 yards before I would have to sit down, let the pain dissipate, then get back up and walk another 50 or 75 yards and try again. So a mile walk would actually take about 25 or 30 minutes because I'd have to stop every 2 or 3 minutes and let the pain go away. Not to mention, picking up the grandbaby was almost out of the question. She was now at probably 12, 15 pounds, and the pain was really almost unbearable. So I had to stop that. Fortunately, I was able to find out about David McCord, Dr. McCord, and I was aware of the almost pioneering efforts he had in dealing with spinal stenosis as well as scoliosis, both of which I had. The spinal stenosis was so bad in 3 of my vertebrae that the bones were literally bone on bone. There was no disc material at all between 3 sets of the vertebrae. The other 2, there were 5 in total, the other 2 had some disc material, but it was paper thin. It was just a matter of time before that eroded away and that I would be in the same situation that the first 3. In addition to that, I guess I was double lucky. In addition to that, I've had spinal scoliosis for quite a while, did not even know it. Apparently, I aggravated it when I played rugby while I was in law school, and it over time was noticeable, but it wasn't bothersome. But in the last 3 or 4 years, it became very bothersome. So I had both spinal stenosis and spinal scoliosis. I came to Dr. McCord. Dr. McCord has the benefit of an MRI machine that is not a reclining machine, but one where you can sit or stand to view the pressure on the vertebrae and the spine when you're in a standing or sitting position, which was good because that's where my discomfort was. It was not so much sitting down or lying down, it was always in the standing position. After having gone through that, he was able to get a very clear picture of what I had, and the prognosis was not good. In the interim, the pain had become so painful that after consultation with Dr. McCord and some of the staff here at his office, it became obvious that the only real solution to return to a quality of life that I had enjoyed for many, many years, the only option left was to operate. So approximately 14 months ago, I went through 2 procedures. One to put in spacers in between the vertebrae to take care of the spinal stenosis. And 2 days later, I had 4 titanium rods put on my spine to straighten up the curvature in my spine, or the spinal scoliosis. He did 4 rods instead of usual 2. Many surgeons still do 2, but he advised me before the operation that he was going to do 4 because that increased the flexibility that I would have post-operation. And he was right. I have some acquaintances who have had similar operations, and they do not enjoy the flexibility or the range of motion that I now enjoy because of the separation in 4 rods as opposed to just 2 longer rods. So a long story short is that it's been almost 14 months now. I enjoy a much better quality of life. I can walk, I power walk daily. I do upwards of 2 miles, 5 to 6 days a week. I enjoy that. I especially enjoy being able to pick up the granddaughter. She's now 2 and weighs 26 pounds. And that's just a real joy. It makes the whole family life experience that much better. As what I would recommend to someone, I would wholeheartedly recommend at least a visit and consultation with Dr. McCord and find out the options that are there. Prior to meeting with Dr. McCord, the only information I really had was that spinal fusion was still the prevalent method of dealing with spine issues, and that fusion, while the practice of the day, as it were, it was going to be eventually replaced by the procedures that Dr. McCord and 1 or 2 others have pioneered. So that was very enlightening to me, not to have to be in a very stiff, unflexible, lack of motion, range of motion that a spinal fusion gives you. It's more akin to the way God designed your spine. I have great range of motion, and the quality of life is back that I enjoyed prior to the last 10 years of my life. Because of the life that I had led, the active life that I had led prior to the diagnosis that Dr. McCord made, some of the traditional options were fusion of the spine, and that was just something that I did not find acceptable because the quality of life and the range of motions that those patients post-op had just were not there. So I decided to go with Dr. McCord, even though it was a newer procedure and something that is not as viewed as the standard procedure to deal with the issues of scoliosis and stenosis. I decided to go with his procedure because it gave me the best opportunity to return to the things to which I was used to doing, and the quality of life I felt like I could have back that I had in much younger days. So that was the basis of my decision, and I'm very thankful that I did that. I'd been used to having had an MRI on a previous occasion, used to lying down in a reclining position. And when I found out about Dr. McCord's MRI machine that allowed for patients to sit and stand, it just made perfect sense to me that in order to properly diagnose something, you had to view the spinal cord when it was in a pressure situation, which is what sitting and standing provides.